Hi, thank you for joining this masterclass about living well with persistent pelvic pain conditions and pelvic floor dysfunction. I am Karla Ehlers. I'm an occupational therapist since 2015, and within the last 3 years, I've been specializing in pelvic health. And I'm so excited to talk about this topic with you all today. And I feel like this approach that I'm taking is what's really missing in the pelvic health space and taking a holistic approach to pelvic health. So let's dive in. So this master class will help you to decrease your fear around pain, understand how your pain is protecting you. You're going to feel empowered that your pain isn't all just in your head. And you'll receive actionable steps towards breaking your pain cycle and living a meaningful life. So, what is occupational therapy? So, occupation is the everyday activities that people do as individuals, in families, in communities to occupy time and bring meaning and purpose to life, right? That means so much. What are you doing throughout your day that is meaningful and purposeful? And so, what else? Occupations are what people need to, want to, and are expected to do. Okay. Occupations are also meaningful, unique, individualized, purposeful, and valuable to the person. And so, as an occupational therapist, I specialize in how these meaningful activities are truly affected by your pelvic health, by the pelvic floor dysfunction, by endometriosis, by interstitial cystitis, all these chronic pain conditions. How are these truly affecting your meaningful activities and things that you want to get back to doing? Okay, so holistic health has to start with this biopsychosocial approach. And so, ways we can do that is focusing on the biological piece, the social piece, and the psychological piece. And at the heart of all of that is you and your goals. Okay, consists of the biological piece is the musculoskeletal system, the endocrine system, the cardiovascular system, the nervous systems. Okay, psychologically, all of these are affecting us as well. Our mood, our affect, catastrophizing, kind of jumping and thinking, not jumping, but physically, but jumping to conclusions and just kind of spiraling, thinking that everything is going to be worse than it already is. That's catastrophizing, stress, coping, all of these things affect us. And then in the social sense, our culture, our social environment, economic factors, and social support. All of these are need to be addressed through this biopsychosocial approach. Now, traditional pelvic rehab programs, they are going to kind of just really focus on more of this biological sense of your well-being, doing imaging, testing, the pelvic exam, nutrition, hormones, exercise, all important, all completely valid, right? With OCCUPELVIC Health and Wellness, this is my private practice. We focus on truly a holistic approach. And so we are addressing the biological, but we're focusing on the cycle tracking. We're focusing on a self-pelvic exam, right? Like how empowering is this for you to be able to understand what's actually going on within your own tissues and feeling comfortable in this space? We're going to address nutrition. I'm not a dietitian or nutritionist, but just from a general sense. And then, of course, exercises as well. But the rest of this piece is what women are missing in truly finding healing within their pelvic health. And so, educating women on pain neuroscience and education. That's what we're going to get into a lot today. Sleep, that's one of our everyday occupations is sleep, addressing that from a deep dive perspective. Nervous system regulation and retraining, that's the piece that we are really focused on in this presentation. But then also anxiety, depression, what is for women that are going through these chronic persistent pelvic pain conditions, they can kind of turn into anxiety and depression because there's so much invalidation and constantly worrying, wondering what's going on. It's not the sole driver. Anxiety, depression did not cause these, but what if your pelvic pain condition cause the depression, cause anxiety. I see this a lot. And so just getting the right resources available and strategies available to get the right help we need. And so just going to or getting a referral for a mental health specialist, that can kind of raise big dysregulation in our system, because we think, oh, the doctor just thinks it's all in my head, but that's not the case. And as occupational therapists, I have specialty training in addressing these things and kind of being that bridge to getting the true deep dive approach that you might need within the mental health space. So we can also address limiting beliefs, constantly thinking, oh, this surgery is not going to work. Why am I in pain? This isn't going to get better. Those beliefs really do hold us back. The connection to ourself and others are totally affected due to persistent pelvic pain conditions. Our habits, our roles, our routines are affected. And then truly finding safety within ourself and our environment is so needed with these pelvic pain conditions. And so we're going to do a deep dive into this pain neuroscience education and nervous system regulation in this presentation, and seeing how this is an awesome approach to help women, and I've seen a lot of success with it. So what is pain? The International Association for the Study of Pain reports that pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So just think about that, the sensory and emotional experience of pain. Like, we have to be addressing the sensory system. We have to be addressing this emotional system of our body, because, this damage, this tissue damage, it could be actual, which we're trying to rule out. Doctors are trying to figure that out for us. But then what if it's just a potential tissue damage? And we'll get into this. What if it's the brain perceiving this potential tissue damage and causing the increased sensitivity? Okay. So what else is pain? Pain is a personal experience that is influenced to varying degrees by biological, psychological, and social factors, right? Just like we talked about that biopsychosocial approach, it is all influenced by varying degrees. Okay, so we have to address all three to find holistic healing. Okay, through life experiences, individuals learn the concept of pain. So these life experiences, unfortunately, for women with persistent pelvic pain, dysmenorrhea, just difficult periods and just going through these difficult life experiences, what is that telling our brain, right? Our brain remembers, our body remembers these things. Okay, so this is all affecting us. A person's report of an experience as pain should be respected. Your pain is real. This should be respected, right? It is so real. And although pain usually serves as an adaptive role, which means it's usually trying to alert us, trying to get our attention that something's wrong, it may have adverse effects on function and social and psychological well-being. Absolutely. And that's as an occupational therapist, I'm addressing this functional deficit, right? What are these everyday activities that are affected by your pelvic pain? What's the social and psychological well-being? What are all of those that are affected by your pelvic pain, right? Our relationships, everything gets affected. Okay, so pain is more than a sensation. It is a multifaceted experience. And this graph shows that it encompasses that biopsychosocial approach, right? All of these factors influence our pain. This is the start of our pain neuroscience education, right? This is kind of what this presentation is going to be about. And Lewis Gifford created this mature organism model. And so just understanding some of this can hopefully help you to better understand your pain. Now, I want to definitely state that pain is so very complex, right? Pain is very complex, and this is just one little minuscule piece to that puzzle of kind of figuring out and understanding what is going on in your brain, in your body. We're first going to start with these stars right here. So when we get some sort of pain response, some kind of pain receptor in our body. It's coming either from the tissue itself or it's coming from the environment. Okay. And this pain receptor, I want you to actually think of it as more like a danger receptor, a danger signal. Okay. And so this danger signal, this electromagnetic current, it gets sent to our spinal cord. And a spot in the spinal cord is going to say, oh, is there truly danger? Does it need to go to my brain? And if it senses this danger, it's going to send that information to the brain for the brain to scrutinize and understand and trying to perceive what is actually going on. Okay. And so once that happens, it's going to then send the output of pain. Okay. And which is going to alter our behavior, alter our physiology within our body. Pieces to understand is that when this danger signal goes to our spinal cord, okay, this piece in our spinal cord is called the dorsal root ganglion. It gets really good at its job, like really good at sending those signals up to the brain to figure out what we need to do about it. And so when that piece in the spine, that part in our spinal cord becomes really efficient at sending those signals to the brain to decide if it's going to have pain or not, that's when we get to have a sensitized nervous system. Okay. And so understanding that, yes, let's see, there can be danger signals that are coming from a fracture, from a sprain, surgery, extreme temperatures, inflammation, this immune response. All of those can send those danger signals to the spinal cord, right? And so this is the piece that a lot of people are focused on, right? Like we're trying to make sure the tissues are safe, to ensure the tissues are healed. But what I want to really talk about today is the environment. This is, as an occupational therapist, this is the missing piece to the puzzle of pelvic health, I think. And through my approach, we are really focused on figuring out these work related stressful environments, anxiety, these financial concerns, these beliefs that, oh, I'm not going to get better. Like that all goes through our head when we have chronic conditions, right? These fears of not being able to do things we want to do, or the fear of the pain itself. Those are all sending danger signals to our spinal cord. And when that spinal cord gets really good at its job, it's continuing to send these pain signals to the brain. And the thing about our brain is that it's one step ahead of us at all times. It is perceiving things around us constantly. Our nervous system is an alarm system. It is constantly surveying our environment, and it's going to remember those past experiences. It's going to remember those thoughts, beliefs, memories that you've had in the past, and it's going to try to help you. It's going to help by sending that pain signal. Okay. And then in a sense, altering your behaviors of, oh, I need to grab a hot pack. I need to do this type of movement, or not do a certain type of movement. Right. And so this understanding of that our brain is in control versus our tissue versus the environment is a really big piece. As we limit these movements that I was talking about, as we limit them or we're afraid to move, the map in our brain doesn't get as exercised, okay? And it gets blurry and smudged, okay? And so when the brain can't find its own body parts, it increases that sensitivity of the nervous system, which drives up the pain, okay? So just understanding that this chronic pain, it causes changes to our brain. And this is an approach that we're really focused on to find, reconnect with ourselves, reconnect with our bodies, to promote healing. This is an amazing quote by Adrienne Lau, a pain neuroscience educator and physical therapist. And just, I don't know about you, but just reading this just kind of also just takes a little weight off my chest. Pain that is understood is not to be feared. We need to get out of this fear cycle of our pain to truly understand what's going on with our bodies. All right, so if you're staying with me, thank you. That piece alone is just kind of can get very very clinical, and hopefully this will help you to better understand our nervous system and our pain cycle. So this metaphor I really like. So this is an outdoor motion detector light. So I want you to imagine if a single leaf blows through and just constantly activates the light, right? And that light ends up breaking. Okay. I want you to picture the light bulb. We're changing the light bulb, or we're putting tape on it or something, trying to fix the light bulb because it went out, right? And we realize that that's the problem, and we think it's the light bulb. But in reality, the problem isn't the light bulb. It's the motion sensitivity. It's constantly being turned on from the whisper of the wind, from the leaf. That motion detector sensitivity is just so sensitized, right? And so it's very much like our nervous system. Our nervous system is our built-in alarm system, okay? And it's constantly monitoring for threats, such as an injury, monitoring for threats within our environment. Do we need to call for help? Or, like whatever is going on, it's constantly surveying. Okay. And so um, this is what the central sensitization can be considered, if you've heard of that. But why do our alarm systems stay extra sensitive? So your pain experience for sure matters. So as long as you're stressed, confused, afraid, your alarm system is likely to remain extra sensitive. Okay, so this lack of validation, this constant worry, everyday pain causing stress, this decreased ability to work, it causes you a financial strain, right? This confusion to the medical care. All of these are causing this extra sensitive alarm system. And so where do we start? So this is kind of the first start, is understanding this pain neuroscience. Like that's this sensitive alarm system. That's one step. And then we have to understand that the safety within our body has to override these overactive danger threats. Okay, these overactive danger threats are sending so many pain signals to our brain. Okay. And so these threats are coming from the tissues, right? If you have endometriosis, right, there's a lot of tissue that shouldn't be where it should be, right? But also in the environment. Okay. And so if we can really focus on this piece of the environment, this is the missing link. So let me go back one. This tissue piece, this is what a lot of people are focusing on. The exercises, we're doing all the imaging, we're trying to figure that piece out, but this environment piece is what's missing. We have to have safety within the tissues, we have to have safety within the environment as well. And so focusing on the work stress, the anxiety, financial concerns, beliefs, fears, all of these things can be addressed through focusing on the environment via the vagus nerve. Okay, we're going to get into that. And so at OCCUPELVIC Health and Wellness is my private practice. We focus on all of these things. And what if I told you that nervous system regulation and retraining can address all of these things on the right side here? By tapping into this vagus nerve, by tapping into the nervous system, we can address the social and psychological experiences as well, to give those cues of safety, to improve our pain. And so how do we tap into feeling safe within our environment? This is through polyvagal theory and through Stephen Porges' education and all of his trainings. And so I have some specialty training with through that. And so this is through activating this social engagement system. And so this is a neural network of cranial nerves, all these cranial nerves, which provide facial expression, sound, swallowing, chewing, all the ways to facilitate safety within our environment. Okay. So have you ever felt, unsafe or stressed due to someone's tone of voice, loud noises, someone scowling at you? These are all sending signals of threat to our nervous system. And this is through the social engagement system that is directly connected to our nervous system and to our environment. Okay. And so The social engagement system that we were just talking about is facilitated through nervous system regulation and retraining through polyvagal theory. Okay, and so first we're going to talk about the three pathways of the vagus nerve, and three, hence meaning three, polyvagal theory. There are three pathways of the vagus nerve. The vagus nerve is the longest nerve in our body. It is our connection to that parasympathetic rest and digest system of our body to help facilitate healing. And so we'll talk about these three systems here. So you've probably heard of the sympathetic nervous system. This is that fight or flight when we're feeling unsafe. And so this can have an increase in heart rate, blood pressure, hormone flow, increased muscle tone. Okay, but when we're feeling safe, we need some of that sympathetic drive, right? We need a little bit of energy to make us feel active, playful, motivated. Okay, but when we're feeling unsafe, this is where that fight or flight kicks in. This is where we're feeling more stressed, anxious, and fearful. Okay, so that's one of the branches of the vagus nerve. The second branch is the dorsal vagal pathway that we'll talk about. This is part of the parasympathetic nervous system, okay? And this, step back for a second, the autonomic nervous system, this is part of our nervous system it's just happening automatically, right? It's happening on its own in order to breathe, to eat, swallow, digest, go to the bathroom. Part of our pelvic floor muscles are innervated by the autonomic nervous system, okay? So this is so important for pelvic health, okay? And so we talked about the sympathetic piece. Now we're going to talk about this parasympathetic dorsal vagal pathway. So this is associated with with lower heart rate, lower muscle tone, lower energy. When we're feeling safe, though, like we need some of this, we need to be able to feel blissful, dreamy, tranquil, meditative. But when we're feeling unsafe, this is where we become depressed, unhappy, lonely, hopeless. You can kind of hear some of the words of shut down, okay, immobilized. This is that dorsal vagal pathway, okay? The third piece is this ventral vagal pathway. And this is part of the social engagement system, okay? And so this is where we have normal heart rate and muscle tone. We're feeling relaxed, engaged, curious, creative, hopeful. Don't those all feel so amazing? And so the goal is to kind of get out of these chronic states of sympathetic, these chronic states of this dorsal vagal, and feed in more messages of safety through this ventral vagal pathway, through these social engagements, this social engagement system. Okay, so the goal is to find balance of all of these. We hear people talk about, fight or flight a lot, but, we need some of that fight or flight to do the things, to have the motivation to exercise. But it's the piece where we fall into this chronic cycle of persistent, always looking for something new, always trying to worry, like what is going on with my care? What is going on with my pelvic pain? That constant fight or flight is really exacerbating a lot of these symptoms. And so, or on the other side, if we're constantly in this parasympathetic nervous system, we're feeling more depressed, unhappy due to being in so much fight or flight, right? It can cause us to feel hopeless. And that's the piece where I hope I can instill within you, is that you don't have to feel hopeless anymore. There is a plan there. We can help with this. Okay, so the goal is to find balance, finding homeostasis within our body. Homeostasis, a steady state of internal physical and emotional balance that allows us to function our best. Okay, but this can be disrupted by societal changes, chronic stress, adverse life experiences, trauma. All these lead to physical and mental health challenges. So chronic health problems, mental health conditions, substance use challenges, attention, learning differences, changes in appetite, energy, desires and interests, difficulty sleeping, feelings of loneliness and isolation, okay, difficulty connecting with others. It's hard to have homeostasis within our body, this balance, if all of these are affected. So what do we do about it? Step one, this is to identify the state, identify the autonomic state that you're being in, and just the pure fact of taking the time to tune inward and noticing what is my body doing. That alone can be like so helpful. So noticing, are you in more of this sympathetic fight or flight? Is your heart rate really getting elevated with different things? And it probably is if you're in a lot of pain, right? Or are you on the other end of this ladder? So this autonomic ladder, it was coined by Deb Dana through and I've learned about this through my training with the polyvagal theory. And, if we're in so much mobilization and searching, worrying all the time, at some point we're going to come to kind of a crash, right? And that's when we fall into this dorsal collapse, this immobilization. You just can't do it anymore. And that's where that hopelessness piece comes into play. So, learning about nervous system regulation and retraining, and a lot of people just say, oh, just meditate, that'll improve your stress. It's like it has to be more individualized by that. And just assigning meditation, that could honestly be one threatening response to our nervous system already. So it is very individualized. So if someone is in more of this dorsal freeze or collapse, we need to bring some energy. We do need a little bit of that sympathetic energy to get out of that collapse and to get into more of this safe ventral state of our nervous system. Okay. And so step 2 is the safety danger equation. So there are 2 ways that our body perceives threats, and it can be through perception. Our brain is perceiving it. And then there's another piece that our nervous system is perceiving threats subconsciously. Okay, so consciously through perception, and then subconsciously through a term called neuroception, which is coined by Stephen Porges. So through neuroception, which is our body just constantly perceiving and subconsciously, like we don't even know that it's doing it. It's always scanning our environment for cues of safety, danger, and threat. Okay. And this is where we can think of the safety danger equation. So as long as we are trying to, measure out the cues of safety need to be more than the cues of danger in order to improve our pain. Okay, so there's always going to be, not always, but you might find consciously, thinking about what are some danger signals that you think might be going on inside of your body, right? You might feel those already, like you feeling some cramping in your lower abdomen, or a sharp shooting pain, or some tension in your pelvic floor. Those are danger signals that are being sent to your brain, right? And so what would be on the other side? How can we facilitate some safety within our body? Right? Like, what if that was like focusing on breath work and noticing the breath coming in through your nose, and to expand your rib cage, to activate your diaphragm, right? And we know that when we take big, deep 360-degree breaths, that the vagus nerve is massaged by that diaphragm. So those are cues of safety already right in there. And so when we're taking these big, deep breaths, and the diaphragm goes down, massaging that vagus nerve, it's also going to massage our digestive tract within our body, within our belly, right, in our abdomen. And so just kind of focusing on those cues of safety versus the danger signals. That can be one tip. All right, so inside the body. Okay, next we are trying to find an equation for outside in the environment. So subconsciously, through neuroception, our body is already just scanning constantly, looking for cues of danger to keep us on high alert, right? And so what are some of those dangers that you might feel? Like, are you actually feeling any of them? Or do you feel pretty safe? Like, so focusing more on how are you feeling safe right now? Are you in your home? Does that feel like a safe environment? Or at work? What's that environment like? How can we make it safer there? not only physically, but emotionally, supportively. Okay. And then this third piece of is between. So inside, outside, between, our body is constantly subconsciously scanning for these cues of safety. Okay, so between nervous systems. And so this is a big piece between relationships, right? What are these danger signals that you're hearing? Are they through a tone of voice? Is it through facial expressions? What are these danger signals that are being sent to your nervous system? And this can, be facilitated, within any relationship, within your friends, family, your spouse, within your provider. What is that connection? And are we feeling more danger signals versus safety signals? And how can we facilitate more safety signals? All right, so step 3 is co-regulation. And this is that connection between our two nervous systems, that piece where it is so important to find safety through this connection. So obviously with a mother and a baby, that is a wonderful co-regulation of the nervous systems. But on this other photo, what is the connection between, this patient and the provider? It seems as though there is some facial expressions and the body language. All of these are so important in order to facilitate safety and healing to our nervous systems and in sense facilitating improved pain, right? And so why is the vagus nerve important? So it really helps us to connect this mind-body connection. It facilitates the communication between the emotions and the brain. It has an anti-inflammatory role. Amazing, right? Helps us to improve pain. It improves gut health and immune function. Okay. It's flexible and resilient. It helps us to not feel stuck in this anxiety, anger, despair when we face these challenges. And then it helps us to have a growing capacity to regulate, right? Regulate meaning we're not stuck in one state more than we need to be. It doesn't mean we don't have any stress. Life happens. We all have stress, but it's the ability to identify those states and regulate in order to not get stuck in that pain cycle, right? And so what can we do about it? How do we live well with persistent pain? And this is the piece as an occupational therapist, really focusing on the feeling more like yourself again by doing meaningful things that help you reconnect with your body and your life, right? These meaningful activities, like, this presentation has been a lot on the pain education and the nervous system function, right? And those are all really important topics. We have to learn about those. But once we got those down, let's take a step back, increase this lens of what is really important in your life and how can we facilitate this growth and this healing and what is meaningful to you. Because when women have, or anybody has, these persistent conditions, chronic conditions, you're likely not doing the meaningful things that you want to do, right? You're not connecting to yourself the way you need to be or want to be. And so through occupational therapy, this is one of our big focuses, is on these meaningful daily activities and how can we facilitate those.